Good evening and welcome to Straight Talk. This is Eugene Chan, and tonight our guest is Dr. Leung Zhihong, who is well known in the medical and political circles in Hong Kong. Dr. Leung is a medical doctor by profession. He's a graduate of the University of Hong Kong and he specializes in urology. Dr. Leung has an illustrious career. He was a member of the Executive Council, as well as a member of the legislature representing the medical function constituency. He has held many public service positions, and I had the privilege of working with him as a member of the healthcare profession, where he is more commonly known as CH. Notably, he has been the chairman of the Hospital Authority, the president of the Hong Kong Academy of Medicine, and the chairman of the Council of the University of Hong Kong. In light of his extensive knowledge and experience in healthcare delivery, including both public and private, as well involved in medical training, he is the best person for our topic tonight on looking at how the government recent proposal to increase doctors in Hong Kong. Welcome, CH.
Thank you, Eugene. I want to be rational and talk about things in a rational way. You see, Hong Kong has always allowed overseas doctors to come to Hong Kong to practice. But there's a prerequisite.
Yes.
And that prerequisite is you must pass the local licensing or registry examination. Mm-hmm. Now, this, as a lot of people think, it is not, and I stress, it is not doctors' protectionism. It is protectionism for the public, because we all want our public to be seen by doctors who we believe they have reached a certain standard. Now, this is what the medical profession wants, and this, I believe, is what any responsible government would not want, that the public will be seen by doctors who has reached an acceptable standard that we consider as satisfactory.
Right.
I think this is very important. It is not doctors' protectionism, but it is protecting the public to ensure that they have proper health care.
Right, CH, thank you very much for stating your stance right at the beginning.
Yep,
and this
right.
is, I'm sure many of the healthcare professionals will feel the same way. Having said that, Hong Kong had a severe shortage of doctors for some time,
Yep.
especially last decade with the increasing number demand for public healthcare services and our aging population. Maybe let's look at our figures. If you look at our public healthcare waiting time, it's going to take 133 weeks to be seen by a medical doctor if you have any medical issues. To see the ophthalmologist, about eye doctor, it takes 123 weeks. Whereas if you have a discomfort with the body, it takes 119 weeks. It's like over 2 years. So, CH, I mean, what do you think about this waiting time, and do you agree it's a problem?
Well, I believe that the public should not have to wait to be treated for their health reasons. And the main reason, as the government said, is we're short of doctors in the public sector. Mm-hmm. Now, okay, let's take another analogy, Eugene. Somebody cuts an arm involved in a traffic accident. Somebody accidentally being stabbed on the body. They bleed a hell of a lot. Mm-hmm. What do? Common sense, if you're a doctor or a dentist or even the public, would know that the first thing to do is to stop the bleeding. You put a tourniquet around the arm, stop the bleeding. You put a towel on the wound, stop the bleeding. And then you try to give blood if necessary. Now, government says there's a lack of it. The government says that doctors are leaving public service in a great amount. I agree. It's like just bleeding. But to do that, isn't it the best way is to stop the bleeding instead of just pumping unmatched blood? So I think the best thing and the first thing the government should do is, why are the doctors in the public service leaving the public service? What is the reason? And is there anything that we can do to stop them from leaving? The Hospital Authority, when we started the whole scheme in the early 90s, has one very important motto. And that motto is to attract, retain, and motivate doctors. Are we doing that? If we're doing that, they will not leave.
Right. See, having said that, I see that there are more training positions now. There are more opportunities for the frontline services. They even take back our retired doctors. I mean, they're doing many things. I have to say they're trying. But having said that, our doctor to population per capita in Hong Kong, we 2 at the moment, whereas in other countries where you compare to, say, Singapore is 2.5 and UK is 3 and Australia 3.8. If we're going to match with, say, for Singapore, we need another 1,600 doctors. Having what you have said, we still have a shortage. Do you agree?
Well, I don't believe that there's shortage of doctors in the private sector.
Right.
Actually, I would say that the private sector today is overloaded with doctors.
Right.
It is the public sector that is deficient. And as mentioned just now, I believe that we have to look for the reason why they are leaving the public service and going to private, and then try to see whether you can retain them to work in the public sector. Because as you rightly point out, the public sector is where training is taking place. Mm-hmm. I think that should be our aim at the end of the day, and not just pumping in unmatched blood by accepting other foreign medical graduates come to Hong Kong without taking examination. Now look at this way, Eugene. There are people who say that there are not many countries in the world that needs to have a license or registered examination. I think that's wrong. You go to America, you go to Canada, you go to Australia. As a local graduate, you've got to take the examination before you can practice medicine. Mm-hmm. You graduate in California, all you need to do is to cross the border to Arizona. You've got to take a registered examination. You go further east to New York, you've got to take a registered examination. That is a norm, and that is what the government used to ensure that their public is getting the best and adequate care.
Having said that, I mean, I have read news that recently in Singapore and UK and Australia, they're recruiting doctors without having examination. Maybe time has changed. What is your view on that?
Well, if you go back to the original principle, that if you want a doctor to be able to achieve a certain standard, you have to use criteria to achieve that.
Right.
Yes, the government has proposed that they will set up a committee to look at doctors from certain universities, whether they're up to standard. Mm-hmm. You look at their curriculum on paper. How do you know that they're actually up to standard? Unless you have the power, the manpower to go and inspect the university, that university. Now, do we have that ability? Do you have the right and to go and inspect other people's university? We do not. So what I mean is that, okay, if you can find a way that you can really go and inspect the university and say, oh, all right, that university's curriculum, trainees up to our standard, then it's agreeable. Mm-hmm. But you cannot have that power to go and inspect the university.
You being a past chairman of the hospital authority,
yes.
Were waiting times that long at your time? And if not, why do you think it has come to a stage where we have to wait for like 2 years? It's clearly not acceptable.
Well, Eugene, if you look at the recent figures, when I was chairman of the hospital authority, the number of doctors in the service is around just over 2,000. Mm-hmm. Today, the number of doctors in the hospital authority is 6,000. Mm-hmm. They're leaving fast. Now, that's the reason. Did our population increase by threefold from 2002 to now? We did not. So it's the doctors leaving the service, giving it a gap that there's shortage of doctors, and we have to retain that. I repeatedly mentioned that if somebody is bleeding, the first thing that you need to do is stop the bleeding, not pump blood.
But having said that, after you have stopped the bleeding, we have to do transfusion as well.
Great.
So where do we find the transfusion? If you look at our local medical training, we had 250 like 10 years ago. Now it's up to 530, like 1.1,
right.
1.12%, 112% increase. Is quite a high number.
Agreed.
Looks like we are not retaining our staff in the hospital authority. Why do you think it's a problem?
Well, as you mentioned just now, we are not retaining our staff in the hospital authority. What is the reason? We do anything to retain them, which goes back to the original idea of the hospital authority, and that is to attract, retain, and motivate staff. That has to be number one.
So you're saying that they're not doing enough retain, and motivate, and
right. That is number one. Like, as I said, bleeding. Somebody is bleeding, the first thing you do is to stop the bleeding, not pumping blood.
Right. Let's look at some other figures. Look at our government doctors. If you look at the some of the figures, at the moment, from the government's figures, we are short of 700 plus doctors in the public sector. By 2030, we'll be short of 850, and in another 17, 18 years' time, 2040, be over 1,000. If you look at compare with this private sector, we'll be looking at another 1,500 to 2,000 doctors. Factually, we are short of the numbers. Even if you retain the doctor in the hospital authority, there won't be enough. How do we fix it?
Agree. As I mentioned from the very beginning, Hong Kong has never stopped local graduates to practice in Hong Kong. The prerequisite is to pass the license or registry examination, and that's the basis is to ensure that our public is getting a good standard of healthcare.
Okay,
we can continue with that.
Right.
There's nothing wrong with having overseas doctors come into Hong Kong, pass the examination, and let them register practice. That will increase the number.
All right, let's have a chat after the assessment after the break. Welcome back to Straight Talk. And we have been talking about the doctor shortage problem in Hong Kong and the government proposal to attract more non-locally trained doctors back. With us is Dr. Leung Chee Hong, an eminent surgeon who had many years of public service, especially with the health sector. So, Siak, before the break, you had a very clear stance to saying that you agree that we need some extra manpower from overseas non-locally trained doctors, but you think they need to have exams.
Yeah.
Before we go on, let's look at some figures again.
Okay.
If you look at the non-locally trained doctors registered to practice in Hong Kong, in the 10 years preceding year 2000, we had 2,224 doctors. In the next 10 years, we have 363. In the last 10 years, we have 396. If you look at the number of new registered doctors, we have reduced from a 45% down to a 10%. So that means our manpower is predominantly locally trained doctors, which is fine. If you look at Singapore, they're having 40% of foreign abroad trained medical doctors.
Eugene,
so
that is exactly the issue. Before 1997, British and Commonwealth doctors can come to Hong Kong to register.
Right.
Why is that? At that point in time, the local medical council follows a recommendation of General Medical Council of UK. Why do we do that? Because the General Medical Council in UK go and inspect, and I use the word inspect, not just looking at the curriculum, all the universities in UK and the Commonwealth. Mm-hmm. They inspect it every few years, and they give the sign of approval that university is up to standard. Hong Kong follows that style. Today, we do not have that continuation simply because after change of sovereignty, we cannot follow the United Kingdom's direction. So what do? Our local medical council has the right to inspect our local university, but they do not have the right to inspect other universities. So how do we ensure that the other universities elsewhere, be they in the United States, be they in America, be they in Britain or Australia or anywhere, is up to the standard that we require.
Right. So
that is the issue.
Right. Having said that, I mean, in pre-1997,
yes,
we had a lot of qualifications and training from the UK, from London.
Agree.
Where you and I, we're fellows of some of the UK colleges in Australia.
Yep.
And we're still recognizing the training and qualifications for the Hong Kong Academy of Medicine. So are we being too dogmatic in terms of having to visit the school and approve their standard? Because according to the government, which a lot of people say, they look at their international rankings, they look at the medium of teaching, they look at the curriculum as compared to the two medical schools in Hong Kong. Is that the only, would you see that as a major problem of not encouraging non-local trained doctors back to Hong Kong, especially with such great shortage? Mind you, we are aiming at only 200 doctors at the moment, and our shortage is very high.
But Eugene, what is the problem of having these doctors from overseas coming to Hong Kong to take a license registry examination. As I mentioned repeatedly, other countries, other places use that system to ensure that their public is up to it's been seen by doctors of certain standard. Why are we giving up that universal, transparent ecosystem, and we're not using it and using something else?
That I agree.
Yes.
But however, recently, in the UK, US, and Australia, they're granting exemptions to attract doctors because there's a great shortage. And I mean, if I'm going to quote our Hong Kong Foundation, make a very strong statement recently that he believes that government should stop creating hurdles for non-local doctors. Do you agree?
I would disagree with that.
Right.
Simply because how do we see our population? How do we see our public? Healthcare is one of the most important things that the public wants. And if you want care for healthcare of the public, you have to ensure that whichever doctor they see is up to a certain standard. How do you assess certain standards that is equal, transparent, that is no discrimination? And the simplest thing, which we've all been practicing for many, many years, and that is to have a universal license examination, so that whether you're from any part of the world, you come to Hong Kong, you take the examination, you pass the examination, you're given the full right to register. But I think that's the easiest way, and I don't see why government should give up this easy way and try to think of certain ways that's difficult.
I don't think they're giving up the easier way. I think they're doing a different mode of assessment. Let's look at the proposal.
Okay.
They are opening up for this program only to Hong Kong permanent residents, basically Hong Kong students who have went abroad to study medicine. And their qualifications must be from a recognized institutions.
How do you qualify recognized
We'll come back to that. And also they have to be registered medical practitioner in their place of study. They have to find a full-time employment in Hong Kong, which is a public services, and work for 5 years after the specialist qualification. And during the 5 years, they have a competency assessment as well. So as you and I, we have been examiners in various colleges. Of course, we look at exams sometimes, look at some of their portfolio, some of their continuous assessment. Isn't that an alternative?
Well, anything is an alternative. But let's use a simple issue. Somebody graduated from a certain university, they are registered to practice in that particular place of origin. They want to come back to Hong Kong, whether they are local graduates, or whether they are local citizens, or whether they are people without a residency status in Hong Kong. They take a simple license examination and they can practice in Hong Kong. Isn't that a simpler way that is non-discriminatory to everybody?
Well, see, if that works for Hong Kong, for the last 20 years, we won't be having such a drastic reduction of foreign trained doctors in Hong Kong.
The drastic reduction
we have some
has nothing
figures
to do with the examination. The drastic reduction is because in the past, before 1997, we are open to all Commonwealth and UK doctors. And I explained to you all the reason why
we know that. Yes.
After 1997, that door is closed. Therefore, people will not be able to come back after the examination.
If the medical doctor still want to practice in Hong Kong, he can still do the licensing exam, which is what you're saying. However, we are seeing that, we hear a few comments. Maybe you can comment on that. Number one, if you want the specialists that we need for our public services, a lot of them may be practicing for a few years, and our exam is on their base as if they are fresh medical graduates, as if they have just graduated. And they have to fulfill the basic medical intern training as well. That's not very, I won't call it an incentive.
Isn't that a very important issue to assess the basic standard of a doctor that you want to
But however, if they are specialists recognized by proper institutions in other parts of the world, surely if they're going to work within our public service system, surely we can do that because we have limited registration with universities, as you and I know.
Agree.
So why can't we make an exception in this case?
There's currently already a criteria for limited registration and temporary registration.
In hospitals, yes.
We are currently facing a situation where anybody from a graduate from a university can come to Hong Kong to take a registered examination and practice. There's also a way that you can come to Hong Kong and practice on a temporary basis. And there's also a way that you come to on a limited basis. There's already there. The whole system is there for you. Say, why do you want to introduce a new system to cancel the long-term system, which is fair, equal, and non-discriminatory?
So it is your view that continued assessment is not as fair or equal as transparent or just doing one exam?
Definitely not as fair as taking a universalized examination.
All right, let's move on to another matter. the government also mentioned they wanted to set up a statutory special registration committee whereby it could be reviewed the list of recognized institutions for every 3 years. It will be just 100. And they will say they look at it from an objective, independent and transparent way, exactly the words that you have used. And they're going to put on the Medical Council Chairman, the Academy President, the Director of Health, the CEO of Hospital Authority, the 2 major universities, the heads, and 4 members appointed by the Chief Executive. Do you think they have the ability to find us a good 100 universities or institutions that will be of providing equal standard that you and I will accept, like the Royal Colleges?
They still lack one very important thing. They are all looking at all these universities on paper.
Or international rankings?
Even international ranking. International ranking takes a lot of issues, as you know, Eugene.
Yes.
It takes into how the graduates are being employed, what is the ratio between student and staff ratio, etc. The most important thing is that do you have the right or ability to go and inspect a university. I think that's the most important thing. Because otherwise you're looking at just paper and you're proving it simply on paper without even knowing what that university really is all about.
Your view is very firm. I can feel that. But having said that, the government is going to push ahead their proposal. Do you think they will be able to attract 200 non-locally trained doctors back to serve our population? Do you think how realistic is it?
Well, I have no idea, seriously, Eugene. But if you look at the whole government issue, it's going to be a very long-term process before they can be registered.
Yes.
Currently, we're using a very simple, transparent, equal process, but they can register in a very short time. Mm-hmm. Now, that has been in practice for over 20 years. It has given people the chance to practice in Hong Kong easily, and they're not using this. They're saying that, well, look, let's look at another system.
Right, see, having said that, we are going to be short of doctors for years to come. Who's going to look after a patient? 2 years waiting list is a long time.
Well, if you agree with 2 things that I mentioned, one is to retain doctors in the public service. Second thing is to allow a university examination for anyone to come in. You solve both problems.
Right,
in the public, you will have retained a lot of doctors there. In the whole section of Hong Kong, you could have increased number of doctors.
Right, thank you, CH. And thank you, CH, for bringing light to the recent proposal to attract more non-locally trained doctors to Hong Kong. And all of you, have a nice week and see you next week. Good night.